Well, good morning and welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Graham Bridgman and I chair the board. Before we start and before I get onto my script, let me say that this is the first public meeting in the newly refurbished council chamber, and we have a gaggle of officers, anxious officers, I have to say, standing in the corner, waiting to see how it goes. But really, let me say on behalf of the members, well done to the team who've done this, because the council chamber is looking superb. And I know there's still a little bit of work to be done. There's some new monitors to be delivered. There's some changes to a couple of things, but basically here we are after a bit of a while, and it's fantastic to be back in the chamber. So thank you, officers. So for the benefit of those who are watching us, let me just explain that we are running this meeting in a live and remote hybrid format. So there are members of the board in the chamber, and quite deliberately we've ensured that we have a quorum of members so that we can legitimately vote on anything we need to vote on. And in the chamber, I'm joined by Councillors Lynn Doherty and Dominic Burke and Martha Vickers, also by Belinda Seston, welcome Belinda, and by Gary Paulson, welcome Gary. Other board members and substitutes not in the chamber and attending remotely, and I'm going to read the list. So apologies if either you're not on there because I wasn't given the name, because I'm looking around the screen, there's quite a few people on the screen, or if you are here, or if I read someone out who isn't actually here. So we are expecting Superintendent Zahid Aziz, Zakia, actually I can see you're there, Tracy Daskovitz, no, possibly not, Abid Irfan, welcome Abid, the Vice Chairman of the Board, Gail Muirhead, Sean, can't see Sean immediately, Sean Murphy, Dr. Janet Lippett, welcome Dr. Lippett to your first board meeting, Andrew Sharp, hello Andrew, Reva Stewart, and then also we have certain people who are going to present, Amanda Lyons, Kathleen Boggess, Sue Brain, Paul Coe, and I think we're also joined by Councillor Adrian Abbs for one of the items on the list. Gary.
Good morning, Gary Paulson, Director of Volunteer Centre, West Berkshire. I also don't notice that Reva has also got my name under her. Apologies, Reva.
That is being fixed. We'll rename. Someone is going to rename you. Don't worry about that. As I think we're all aware from many meetings that we've been holding, meetings are live streamed to YouTube. In the chamber with us, Gordon Oliver is clerking the meeting and Thomas Dunn is Zoom host. So I've already said that only board members in the room can vote on items, but where necessary, I will take an indicative vote of everybody, or all the members, through Zoom hands to see what our views generally are. Gary, would you? Thank you. Right, and also, as usual, this being Health and Wellbeing Board held at 9:30 on a Thursday, and this being a Thursday in the offices at West Berkshire and Newbury, there will be a fire alarm and a lockdown alarm at 10 o'clock. So if anyone in the chamber is speaking, it is possible that we may need to mute, hold fire for a couple of minutes, let that pass, and then carry on. So, first item on the agenda is apologies for absence. Gordon, have we had any apologies?
Yes, Chairman, we have apologies from Tracy Daskovitz, Councillor Joe Stewart and Councillor Vic Jones.
Thank you. And just the other comment I'd make is there's something about the lighting in this chamber that makes me look as if I've just come off the beach. I can assure you that is not true. Right, those who were present at the meeting of the Health and Wellbeing Board on the 17th of February, does anyone have any amendments they want to suggest to the minutes? I see no one itching to make an amendment. So I won't do an indicative vote for that, having made sure that there's no amendments to be made. So I'll ask members in the chamber who were present to say whether they agree the minutes. I'll propose them. I think Councillor Doherty, as usual, will second them. And that is unanimous in favour. Thank you. And there's a signed copy in anticipation. Moving on. So the next item on the agenda, members, is the list of actions arising from previous meetings. You can see the items, they're rag rated, those that are red, green or amber. Obviously there are two reds, but you see the comments there. I think the 181, which is red and hasn't got a commentary, I understand that Andrew Sharp and Nikki Cartwright yet to discuss the CHC arrangement, so we will leave that to that. The other comment I've got is that on item 189, this is the review of workshop feedback and report back. That is an ongoing task, and it was going to be on this agenda, but it's been put back so that Zakia can do some more work on that. So with those comments from the chair, Councillor Vickers. Microphone, please.
Right, okay, thank you. Yes, it's just the item 183. I'm not aware of having received any information regarding that. Can anybody confirm?
Well, clearly that was something that was in the hands of BHFT. So what I'm going to do is ask Gordon to check for you, confirm and deal with that with you offline, if we may.
Thank you. Thank you very much.
And Councillor Bowie.
Thank you, Chairman. Action 186, agree who will progress matters in relation to the Healthwatch CAMS report. And the narrative says who is going to progress the matters. It's reported as amber in progress. I think it should be closed. Although the matters may not have been resolved, that's not what the action calls for.
Fine. The comment I've got in my notes on the meeting is that Healthwatch, maybe I'll come to Andrew in a moment. Healthwatch has been in discussion with various partners on the back of the CAMS report and organising another Thinking Together event to explore the issues further. So, Andrew, have you got any particular comment you want to make on what Councillor Boakes just said?
Yeah, I mean, there has been a discussion on the next Thinking Together event going forward. The only thing that hasn't happened is we haven't had a chance to discuss it fully at the Children's Delivery Board. So, and I think if I could just raise a sort of an extraordinary item, Mr. Chair, in relation to all of this. There's a CQC report out this morning in relation to the Tier 4 for children's facility where ratings have been suspended due to concerns. So I think while this particular item, I believe still remains in need of our being able to present to the Children's Delivery Board, there are actions being taken place. So I think in light of you know, certainly some of the information going, I think this needs following up, but I'm happy to follow the lead of the chair from the Children's Delivery Group.
Well, I guess the question is it a live item or is it a closed item? That's really the question for all of us. I'm happy if you're, I mean, it's your portfolio after all, so I'm very happy.
My point is that the action that's on the 186 says who will progress. We know who's progressing. It's the Children's Delivery Group and it's
the actual progression of that.
That needs to be tracked.
Yeah. Okay, so Gordon, we'll close that item and maybe open a fresh one about tracking.
Perhaps report back, Chairman.
Indeed. Got that? Yeah. Noted. Thank you. Councillor Doherty.
Yeah, I just want to go back up to 169. My eyes are always drawn to red, and quite honestly, if it's taken a year to get a meeting together, I don't think this is going to happen, or it's probably no longer required. But there was going to be a meeting between the Health and Wellbeing Board Engagement Group and PPP, and that was last July, and we're nearly in this July.
Yes, indeed, and the difficulty there is obviously that the chair of that group has gone on to other things within the health environment, and we haven't identified, and that's the difficulty, and to some extent, the ongoing situation with Bob and with the ICS, with the ICP, with what's happening with the CCG and the whole health agenda.
So is there a conversation that's needed with PPP that we need to be having and we can put
Well,
somewhere else?
can I- Sean's-
This action no longer.
Yeah,
But Sean's put his hand up, so welcome.
yeah. I
Sean.
was going to say, Chair, we did try and progress this, and we would still be very keen to progress this because, as you know, within the public protection priority areas, there is an awful lot that touches on the work, you know, the priorities in the health and wellbeing plan. So we would like to progress this, but we did try, and unfortunately we didn't succeed. So we'll look at another route.
And I suggest then that we close that item and leave it in Sean's good hands, because I know Sean will keep an eye on it, to progress it as necessary from the angle of the PPP. Then there's a driver external to this group to make sure that something happens. Okay, Sean, over to you on that one. Councillor Bowick, is that yeah, I thought that might be a legacy hand. Members, anything else on the list of items? No, let's move on. So next item, formal item, is declarations of interest over and above those that are marked in the summons. Have we had any declarations, Gordon?
We haven't received any in advance of the meeting.
And does any member have any particular declaration having had a look at the agenda? No. I mean, clearly, so far as it's necessary, because Royal Berks has been discussed, I make the same declaration as I made last time, which is I'm a governor of the Royal Berks Trust, but that won't stop me entering into the discussion. Next item on the agenda is public questions. Gordon, have we had any public questions?
We haven't had any public questions, Chairman.
And you may as well leave your mic live, because the next question is petitions. Have we had any petitions?
No petitions are there.
Let's move on with the main thing. Okay, so we're now on to Health and Wellbeing Board membership. Now, there is a list in your pack, and that is the most recent list. This is the list that was presented to the annual meeting of council not that long ago, a week or so ago. And Health and Wellbeing Board's an interesting beast, because they are mostly statutory, but there is a role for the council, and obviously there's a role for the CCG in particular, and other statutory elements in the membership of the body. So, so far as the council is concerned, essentially what we have done is we have left the leader, because certainly when health and wellbeing boards are set up in the first place, it is the leader of council, where we have a cabinet system who appoints the member, because there has to be at least one, or members of the board. And we have essentially had it that going forward, the leader will appoint the members from the administration on the board, and there are 4 of us. On top of that, the 2 opposition groups, the Liberal Democrats and the Green Group, each put forward a member, and I think that is effectively accepted on as a fait accompli. Then there are certain other statutory members, for example, the DAS and the Director of Adult Social Services and the Director of Children's Services, who in this case happen to be the same person, the Director of Public Health, and at least one representative from the CCG must be on the board. Everyone else is effectively appointed by the board, and we really haven't bottomed out the question as to whether or not the board needs to agree those memberships or not. However, I do think that it isn't a bad idea for us to once a year look at the membership of the board following the annual meeting of council and just confirm that we're happy with the membership. So members, you have at agenda item 7 a list of all of the current members and the current substitutes. As always, if your name is there and you don't show a substitute, I'd be very happy for you to nominate one, because it is always helpful if someone can't attend for someone to turn up in their place. And I'll take that on block when I've taken a couple of questions. So I'll start with Councillor Vickers.
Thank you, Chair. Yes, first a comment. I see we have Sovereign Housing as a member of the board. I think my question is probably the input, particularly of that organisation, into this board. I mean, I'm not aware of them attending meetings, as I assume they get reports. I mean, there are other agencies, obviously, that don't attend meetings. I would hope that we'd at least get sort of input as to possibly their concerns. So if you're on a board, surely you should be taking an active an active part in it. I'm just, because sovereign housing, I think, is important. Member there must be lots of issues. They have an experience.
Well, indeed, and I'd point out Matt Hemsby is in the meeting.
He's actually here, is he?
Yes.
Oh, I do beg his pardon. Where is he?
Hi, Martha. I'm right here.
Oh, well, I'm very pleased to see him. Thank you. It's just that I'm not aware of him being there previously. So really, I'll have a look on my.
I've attended. I attend regularly.
Yes, thank you. I'm really pleased to see him because I think it's a very valuable organisation to be part of it and to be having an input. And the other comment I was apologies if I was denigrating your absence, and pleased to see you.
No, I'm so sorry, Martha. Unfortunately, I'm in one of our offices today, but I regularly attend these meetings, or I'd always make sure we send a deputy for these. We consider it one a very important meeting for us to be here.
I think possibly I'm more aware of you now, having exchanged some recent emails, and maybe your deputy has been there in the past. So apologies for that, but very pleased to see you. My other comment was about representation of young people. Do we have somebody that sort of speaks up for them?
Well, I think that we have to, firstly, there is a general concern, I think, and this goes across all sorts of health and wellbeing boards, that you can just get too big and you can have too many members. We also don't forget, a very important piece of the work of the Health and Wellbeing Board is all the groups that sit underneath. And there are a whole host of groups that sit underneath. And I'll look to Councillor Bowick in a moment. Abid, I'll come to you when I've taken Dominic. So there, I think the voice of youth is represented, but not necessarily as a direct member on the board. And I think that's fine, because there are all sorts of groups we could suggest might have a presence, but that's the whole point of having all these different subgroups and the Health and Wellbeing Steering Group, which listens to those subgroups and makes sure that what they need to be said to the main board comes through the main board papers. Dominic.
Thank you, Chairman. I can reassure Councillor Vickers that the entire focus of my portfolio is children and young people. And we are doing a lot at the moment to hear more from our young people. I think it's, if the charge is that we don't hear enough from our young people, that's a fair charge. And we've got a number of initiatives underway at the moment aimed at exactly doing that, hearing more from our young people. And I will always bring forward any concerns that are expressed to me relating to the Health and Wellbeing Board to this meeting.
Thank you. And before I come to Abid, I'll just say that so far as Abid and I are concerned, of course, one thing, I don't know whether Abid's heard anything, because I'm still waiting to hear what's happening with the CCG representation, because as you appreciate, the CCG has a statutory representative on this board, and the CCG is disappearing. Abid, have you heard anything?
Thanks, Chair. I was just going to comment on that point and say, technically, no, the answer is no. So technically, this is my last board meeting. I don't know if you're aware of that, but I won't, as things stand, unless something comes, unless Amanda's got any news, this will be my last meeting as the Icb the CCG transitions to the Icb. Now, I did raise this at the Icb Development Board a few months ago with the Director of Governance, Catherine Mountford, and we kind of said, as chairs, that we should have clinical involvement. Now, whoever that person may be, doesn't matter. And with obviously an exec from the ICS. Now, that was a few months ago. So unless there's been some developments that I'm not aware of, I've not been plugged into, I don't know, Amanda may know, but we've got 6 weeks to go. I haven't personally heard anything. I don't know if that's in train, but I would like to know the answer as well. So yeah, thank you for raising that. But otherwise, if there is no, then yeah, as I said, this will be my last, and my last steering group meeting will be next month. Thanks.
Well, I'll come to, I'm seeing who's got their hands up, but I'll come to Amanda next in a moment. Clearly, there has to be legislation to replace the CCG, because the CCG will have its statutory finger in all sorts of different statutory pies, and therefore it can't just disappear and leave a void. So something is going to have to shift somewhere on the legislative agenda. Amanda, what do you know about it?
Thank you very much. The 2022 Health and Care Act received royal assent late April. We're just waiting for the Act itself to be published by government. The bill with its amendments is still the only publicly available document. So until that is available, it is very difficult to statutorily answer these sorts of questions. I do understand, though, that the DHSC is expecting to provide sort of working guidance for health and wellbeing boards, which I suspect, but don't know, will incorporate such changes in terms of membership in July. So, but I know it's funny enough, I was talking to Catherine Abid yesterday, and we knew that this would potentially come up as a discussion point in your meeting, and indeed other health and wellbeing boards. So we are pursuing to understand further the exacting responsibilities, but I would find it odd that that a place representative from the ICB would be the sort of natural sort of direction of travel, but that may be clinical, and that's the important piece here, which is the role that Abid currently fulfills as vice chair for you.
Well, let me say, firstly, if really this is your last meeting, Abid, I want to thank you unbelievably for the amount of effort you've put into this. You chair the steering group. You turn up to these meetings, your input is invaluable. But I do very much hope this isn't your last meeting. And I hope that sense prevails and things get sorted out. And clearly, the statutory position has to be sorted out. They can't just leave a hole in the Act. But let's assume that it's sorted out and that place has a place, or in our case, two, on this Health and Wellbeing Board, then I would make the plea through Amanda to the ICB that our views on who those representatives might be are listened to. I say no more than that. I'm moving through those who've got their hands up. Gary.
Thank you, Chairman. Yeah, just again, perhaps just a bit of reassurance for Martha on the children and young people. The Volunteer Centre clerks the Special Educational Needs Voluntary Sector Board, which comprises about 20 organisations to support the children's needs and families' needs. And also we clerk the Children and Young People's Voluntary Sector Board, which includes all ages of young people. Again, about 18 organisations that attend those, and relevant council officers get invited for relevant agenda items. And if there's specific things, then I get shouted on things as well. So I also bring that voice here when needed.
And Belinda.
Thank you, Chairman. So just to say, looking at the list of the membership, that I'll be reviewing who the substitute is for myself. I noticed that Joe Reeves is actually the named substitute, but actually I'll get back to Gordon with who that person needs to be going forward.
Fine, thank you. And if it's not Joe, would you wish her very well from us, because of course, Joe used to be one of our officers, and we've worked very closely on all sorts of things, not least COVID, and so we like Joe and we get on very well with Joe. Thank you.
I will do. Thank you.
Councillor Doherty.
Yeah, I'm just looking at the vacancy, the employer representative, and we haven't had a lot of success with this. And I'm just wondering, how long do we keep this as a vacancy, or have a conversation about how we can make sure that we're working with local employers to support local employees, if it's not just with one vacant seat, which has been vacant for I don't know how long. I just think we need to clear this up and find a different mechanism if this isn't the mechanism.
Well, can I suggest that we deal with the membership we've got in a moment, and I'll just deal with that, and then we have a conversation about whether we should have an employer representative and how we're going to go about that. So let me just stick with what we've got, make a couple of comments. Firstly, you've obviously heard about from Abid, and we very much hope that his presence remains. I also want to, as I've already sort of welcomed, but I want to welcome again Dr. Janet Lippett, who's the new representative for Royal Berks Foundation Trust, and her substitute's going to be Andrew Statham. Janet is the Chief Medical Officer for the Trust, and Andrew is the Director of Strategy. The other point, so that everyone's aware, you know, of course, Matt Pearce left for pastures new, and therefore there is a space within the board for the service director for communities and wellbeing within the council. We have made an appointment, but I can't make any announcements because time is still being served, and we want he or she in the room before we make those announcements. So watch this space on that one. And in the meantime, Zakia is continuing to substitute, and it will be deputised for him or her. So members, I think I'm going to take a vote on this to confirm. So, and again, I'm not going to take an indicative because I think this is another fait accompli, but members in the room, can I ask you to formally agree the membership of the board as before you in the papers? I'm going to take proposing and seconding as last time, Councillor Doherty on her behalf. She nods. Excellent. Right. Okay. Let's now move on to the question of employer representative. I'm going to turn to Andrew Sharp. Andrew, we've had these discussions many times. What's your view on this?
I think having tried to get one or two people to do this, I think that there's an interesting point here that although employers have sort of said they might be interested, the commitment to actually come along to regular meetings and what have you doesn't seem to be. I'm not clear that they think there's a good enough reason for them to come, or that they themselves or will get enough out of it. And I think that's chiefly the reason for the struggles we've had. And also, it's really difficult to find a person or a company that represents the really diverse businesses we've got in West Berks, because we've got some very big technology companies, obviously, but we've also got lots of rural businesses, lots of SMEs, as well as all the support services. So sadly, with Thatcher Research, who I thought would have been quite interesting for a number of reasons, the contact I had there, I'm afraid, is no longer with us. So that's almost certainly not going to prove worth pursuing any further. So I wonder whether, unless we change the offer or look at an association, whether we're going to continue to struggle with this.
Thank you.
Yeah, Chairman, I agree with Andrew. I think it's having a purpose really for them to come, and maybe one way to look at it is to have an agenda where we focus purely on the needs of local business or businesses in West Berkshire. There are a number of, and I suspect even now, well, probably over now, but there are a number of business breakfast clubs, such as Jack of Newbury, BNI, a new one's just been established at Metro Bank, actually in Newbury, networking and so forth. And I would have thought perhaps, one of those chairmen of those organisations could represent the interests of small businesses, actually, which might be more interesting than a generality of a large employer, which I think would get perhaps a more realistic and on the ground feel for how it feels to be in business in West Berkshire. So, but I would think it's about the offer, and I think it's relevance, and maybe a meeting focused wholly on the needs of business would be a way to attract someone.
Thank you. And Councillor Doherty.
Yeah, I think we perhaps need to change our approach. A shameless plug coming up. So recently, West Berkshire's economic development team have launched their website, businesswestberks.co.uk, one-stop place for all your business needs. And I wonder if the Health and Wellbeing Board need to actually do something proactive with the economic development team to put some content on there to tell businesses how they can get involved and what support they potentially could offer employees, so we could tie that loop up. I wonder as well if it's a conversation or an agenda item that we could, rather than someone coming to us, push outwards. So I'm a member of the LEP board. We have the Thames Valley Chamber of Commerce operating, and I just wonder if we need to change the focus from having a member sat here to pushing more information out to those areas, such as Gary's mentioned as well, the network groups, to have they thought around and have, this is where we can potentially get help for your employees, and are you considering these? So I think we need to change the tactic.
Can I suggest we then give it another whirl? Let's leave the vacancy there rather than removing the concept of a representative. Can I let you have a conversation with
well, I was going to
Gordon
say
about how we take that forward?
I was going to say surely it's an action, and I
Yeah.
would say we remove this. We haven't had success with.
As promised, there'll be a lockdown alarm. That's all right. It's outside the room. We don't have it in here, so we carry on.
I mean, to leave this, it just continues the space, which I don't think we're going to fill. I think it's the approach needs to change. I'm happy to take an action that we have an agreed approach that pushes that information out rather than having one person sat in here.
Fine. Let's go on. We haven't had an indicative vote for a while. Let's have an indicative vote. Members, those in favour of removing this line of the membership, so we remove the concept of employers' representatives, as Councillor Doherty suggests, and leave it to some communication with the economic team as to what goes on in this space. And obviously, if we find someone coming forward who might be interested and is interested, we can always put it back in again. Those in favour, Zoom hands, remember. Please show. All done. Those against. Members, the indicative vote isn't unanimous, but is in favour of removal. So with that in mind, I will ask members in the room to vote for removal or not. Please show. Physical hands for anyone who's voting, and those against. So that's removed, and we'll leave it to see what comes forward. Thank you, members. Right, we now move on to yet more interesting, actually, from my point of view, because this is an update on where we are with Bob, the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care System. Amanda Lyons is with us to present, and Amanda is Interim Director of Strategy and Partnerships for Bob. So Amanda, over to you, because this is a verbal item.
Thank you very much, and I have prepared a few slides which happy to share afterwards for the benefit of members. So there's three key areas to update on in relation to the ICS development. One is the following the 2022 Act, Health and Care Act receiving royal assent. An update. Thank you. An update on the system delivery plan, which was published on the 31st of March, which is an NHS England and improvement requirement, and just some early just sort of pointers on what I'm describing as a sort of preparatory phase for the that's pre-ICP and ICB establishment, in order for us to collectively prepare for the ICP strategy, which is required to be completed by 31 December 22. So being quite swift through that. So next slide, please. So key development activities. It's no surprise with the tight time frames now from royal assent being received to the establishment order being 1 July, that much of the focus now is on the ICB establishment work and the areas that need to be there. So some headlines here for you. The Icb Constitution, it's drafted for, it's due to be submitted tomorrow, actually, but for the I'm using this presentation for a number of you, but it's in line, it's ready to go. The the ICB has published for comment the Working with People and Community Strategy. The ICP working group is in train, and I know there's been correspondence in relation to that, Chair. The readiness to operate statement. So this, for those that don't know what this is very much the lengthy checklist which makes sure that the due diligence has been completed so that the ICB can fundamentally operate on day one. So have the contracts been novated across? Is there a payroll? Is there a general ledger that reflects the fold-in of the 3 CCGs? So very, very granular detail. We've had internal audits look at that, and the regional office have also reviewed that. I'm pleased to report that it's not without risk, of course, because we're now in that. I was reminded, I think it's 31 days, working days to go, but green ticks. So, positive assurance in that space. And the CCG staff 2P transition consultation is closed. And I'm sure you're aware, but an interim ICB executive team is in place, and that is making a positive difference for us. Next slide, please. So the system delivery plan, I've included here, so when you get it, a link to its published piece. This is in effect setting out the year one establishment plans for the ICS. It covers two, and I'll show a few areas, but it was there to set out really a focus on the ICB architecture, so the governance, the staff, safe transition of people and staff, which I've just alluded to, but then moves on to the more ICS development phases. Well, maybe not as you expect, but the level of work that has been completed is higher in the ICB architecture because that has to and needs to happen. And in terms of ICS development, much of that work is commencing, but will have primacy once the ICP and ICB is legally established. Next slide, please. I was very heartened by the conversations I was listening to here, and actually interestingly there's 4 aims that the white paper originally set out, and I'm trying to hold us true to that in our thinking. So improve, and I'm sure these will ring true for you and they're not unique. This is the white paper. So improving population health and healthcare, tackling inequalities, outcomes and experience to access, enhancing productivity and value for money, but for the NHS, helping the NHS to support the broader and social and economic development. So I was really interested to hear the conversation that you've just had in terms of the relationships with business, and I just encourage you to, that as time evolves, as you voted on, think about, that gives us something new to think about in this space. Should we next slide, please? Thank you very much. So these are the work streams that I was alluding to on the focus on ICB architecture and ICS development. The key thing here is it is about development of the ICS and its 2 different statutory bodies within it, but it's not looking at operational planning and delivery for the NHS because it's easy to confuse the 2. So that's the key headline on that slide. Next slide, please. What this is trying to show is that we are trying to hold ourselves to account to really get the ICS and the ICB in into being. Thus far, we hit the April milestones, and we are very much in progress to make good inroads to where the key headlines where we want to be for July. And One that will be quite close to the importance for all health and wellbeing boards is that the recruitment processes for the place executive director are well underway, with stakeholder panels next week. I can't remember, hang on a moment, I can't remember the exact interview dates, but positively there's a good representation in that area. Next slide, please. Given the importance of this statutory change and the wider scope and remit of the ICS, we want to make sure that we do what we propose and develop it further, because this is a living document in my mind, and there's an important role for both the Integrated Care Partnership and the Integrated Care Board and its formal subcommittees to do that. And we're really keen to make the best use of the membership of those groups, but also the place-based partnerships, which will be a key component of the new structure. Next slide. So, ICP strategy. In the same way I answered the question about the membership of the Health and Wellbeing Board and the role that CCGs had, and what will the role of an ICS have, there is a degree of ambiguity currently on the ICP strategy, but what we do know is this strategy needs to be completed by the 31st of December, which doesn't really give one enough sufficient, significant time if we took the starting date for thinking about this as 1 July. So the chair designate and chair and CEO has asked me to start to think about it, and to start to think about what's the preparatory work that needs to be done, and what does the current guidance say that we've already got. And there's some core components here which appear to be clear, and that is the importance of the 5 health and wellbeing board strategies that currently exist across our ICS, and the importance that this will inform the strategy development, because there's great work that's happened, and also the importance of the NHS work in terms of core 20+5, which is the expected response to health inequalities. And Ansar, who's the Director of Public Health in Oxfordshire, chairs an ICS-wide board, inequalities board. So we are establishing really close working relationships with the directors of public health, and it's a shame Tracy's, I know she's on leave because I was catching up with her last week, but also we just want to make sure we do some early work to just make sure, particularly from an NHS perspective, we get a good fact base of information to support the work that you already have with your joint needs assessments to inform this work. Next slide. I'm not going to go through this, but this is in the system development plan, which sets out some early thinking and the current priorities of the ICS, which are elective care recovery, the provision of urgent and emergency care, and a focus on children and adolescent mental health services and temporary staffing, because in the absence of a strategy, inertia is not a good thing in healthcare. We all know that. So that's making sure we focus on what are clearly, from a health perspective, necessary priorities. Next slide. I think we're nearly there. And this is for your review when you get the slides, just some of the work that's happening, so that we're in a good place to start meaningful conversations and meaningful work from 1 July. So please see this as preparatory work in the app, to buy us some time to have quality conversations and quality engagement with our public, with our staff, and with our citizens. I am expecting that children and young people will feature as an area quite heavily in this strategy, not from our perspective, but the direction from government, I think, will take us to that place. So that will be, I think, is a new emphasis, certainly for health, in terms of strategic planning. I'm going to pause there.
Thank you. I'll make a couple of comments and I'll open it up to members if they've got anything they want to ask you. First, I'd suggest that in fact you have 3 health and wellbeing strategies, not 5 to assimilate, because after all, the Berkshire West strategy is a joint strategy between the 3 Berkshire West local authorities. So there's only one strategy between all 3 of us, really. The question as to who's doing what within that strategy and the delivery plans is another question. But we've all signed up to effectively the same strategy. More fundamentally, and you'll be aware of this, but I think it's worth making other members of the board aware who aren't already aware, there is what I perceive to be significant disquiet amongst elected members about the involvement in development of the ICP. There is a feeling between at least 2 of us, of the 5, and probably more, that we're being excluded from the discussion, and that it's an officer discussion, and that hasn't been brought out. You'll be aware of that. I simply mention it. I don't need to go into it because there will be yet more correspondence and conversations going on into the near future. And the other thing I would just mention again, so board members are aware, of course, the membership of the ICB isn't yet sorted completely because we've got the 3 partner members that to be appointed, and those are out for nomination at the moment as we speak. I think the letter regarding nomination only came out the other day, so that process needs to be gone through to get those. So that's the representative for the local authorities, representative for the trusts, and representative for the PCNs. So I simply mention those things as sort of additional to what you've said. And now I'm looking to see whether anyone, Councillor Vickers.
Thank you, Chair. Yes, I mean, I'd support your comments. I think it's extremely important that members are involved in this as where they sort of channel of communicating what's happening to members of the public. And I think there's probably a lot of, I doubt if people out there even know that anything is happening here, and it is an important change. But it all does feel as though it's happening way up above our heads, and it'll just happen whatever we say. And I think that is probably how members of the public would be feeling. I mean, my main concern, and I think one of my concerns, and I think a public concern would be, that services on the ground don't change. You talk about access in one of your concerns, and focus on inequalities. It's really important that people who can't afford travel, who might not have access to a car, etc., that they have their services as close to home as possible, and they don't have to travel because of referrals, the way referrals are handled, sort of out of district. So on such a large, central organisation, it's important that this is taken into account. So local involvement is important here. So access to services, thinking about inequalities and how people can access the care that they need as close to home as possible. I think, or with adequate transport is really important.
Well, I think, and obviously Amanda, you can pick up on any of these things you wish to at the end. But I mean, I would say that the trusts are still the trusts, the PCNs are still the PCNs. So that local and acute service of the population isn't changing. Though that is not changing. What is changing is obviously what was the role of the CCG in all of this, and the hierarchy, and in particular, and this is where I think this is the opportunity of this beast, the driving forward of the strategies, because after all, from our perspective, the health and wellbeing strategy that we've all signed up to, and more to the point, the delivery of that strategy is key. And what we want is the conversation with the ICP sort of in particular, and then through to the ICB and therefore into the system, as to how we jointly drive those delivery plans forward and do what we intend to do, which is improve the health of our population and reduce the level of health inequality. So that's just a flavour from me. Gary.
Yes, thank you, Chair. Yeah, for I think 2 years now, myself and my colleagues from Reading and Wokingham and Oxfordshire and Buckinghamshire CVSs have been working very hard to ensure, at least try to ensure, that the voluntary sector voice is very much heard within the new framework, and we don't want to lose sight of that. Equally, Healthwatch as well are working hard to ensure that patient voice is going to be embedded at the right moment, because actually what we're looking at is commissioning. And actually, we need to make sure that we're at the table high enough upstream to make sure that we're not left at the end of the day when we ever seem to sort of winter pressure monies rather than sort of 3-5 year plans to use. Because I mean, the work that we've been doing has been funded by Health England actually to ensure this, and it would be a shame at this last point if we're not actually at this table. It may not necessarily be a West Berkshire voluntary sector person, but certainly somebody within the Berkshire West should be at that table representing the voice and the dynamic voice actually of the voluntary and community sector on delivery.
Andy.
Thank you, Chairman. I'm really warm to hear the comments, Amanda, about the children and young people element being important going forward. We've certainly struggled with that in the past, so it's really positive to hear that. My only comment, though, is similar to the comment made by Councillor around membership of the development group. So in terms of children's input, there's very little within that group because the numbers are so tight. And I know you're trying to put arrangements in place to make sure the voice of children's services is heard, but actually I do have some concerns about the ability to do that if the development group doesn't contain a broad enough spread. And I think a similar issue relates to public health around that as well. So it might be an offline conversation, but I do think we need to discuss how we manage that going forward.
Andrew.
I just wanted to say, from a Healthwatch perspective, there's been huge improvements in the level of communication with the ICS, which is absolutely to be commended, and thank all the officers for taking the time to do that. Our concern, I think, though, going forward relates to things like how the programme boards are changing, and even what you call internal stakeholder comms don't seem to be as strong as they should be. There seems to be lots of programme boards where we're often seemingly missing the public health element or the local authority element, and it just has this feeling that the NHS is designing everything for itself. I don't mean for itself, but by itself. And what we've actually seen here is this is a chance to take a genuine joint system approach. And I'm just concerned that without that real high quality internal comms between local authorities, between public health, between social care in key programme boards as they reform, some across Bob, some across place, it feels sort of incongruous that, well, we're sat there, but sometimes public health isn't, and we're talking about how inequalities are going to be progressed in primary care or secondary care or mental health. So I just sort of, it's a bit of an appeal to sort of see if you could, if the same improvement we've seen in the last 4 or 5 months of Healthwatch has been brilliant, needs revisiting with. I think there's almost this assumption that all those partners are on board, but I'm not sure that it's being checked. It's like, because I just don't see them in the room in some of these key programme boards. I don't know if Abid's got any comment on some of that.
Yeah, I mean, I think from a clinical point of view, there is work ongoing with the new CMO who's looking at the various programme boards, and that structure hasn't been sorted or settled, and I suspect may not necessarily be by the 1st of July, but I think it's an ongoing project and work, so that needs to be refined and so forth. So I'm quite confident that will happen now with the new leadership, but I agree. I think we need to work through that and make sure that the right voices are in, as we have done, and we've worked quite hard up to now with CCGs to make sure kind of Healthwatch, getting patient representatives and so forth. So I'm sure that will continue, but the detail needs to be sorted out.
Thank you all. I see no further hands. So Amanda, of course.
Yeah, no worries. Thank you. And some really, really valuable comments, and actually not far from where I'm sort of initially thinking, and I've given you the headlines of some of the thinking. So a couple of things to add, which I hope serves to reassure. So absolutely, in terms of Health Watch, there's actually not that we require an explicit requirement in any guidance to act in this way. The tone of what is expected of an ICP strategy is absolutely where you're going in terms of the role of the voluntary sector involvement, the involvement of Health Watch. But actually, what I haven't even touched upon is some of the early thinking in terms of that engagement with communities, Councillor Vickers, with communities, with the public, and actually how that that connectivity with yourselves, you know, could work. And I'm very much taking soundings from Tracy to make sure we get that right from the start. Hence hence my sort of idea of this pre-proprietary phase, so that we do that thinking, so we don't go collectively, oh, we got that so wrong, because we've got the real opportunity here. And the piece of work which I have started, which is looking at those the health and wellbeing board strategies. And thank you for explaining to me, Councillor Bridgman. I'm hearing different views of the role of the Berkshire West Health and Wellbeing Board strategy. I'd started with the lens that you've described, and I've had different ones played back, so it's really helpful to hear firsthand. So I have stood back actually for my own benefit and looked at the three health wellbeing board strategies, and actually there is some fabulous consistency in terms of what is considered to be a priority. And then there's the local nuance, and that's going to be the trick here in terms of what's the benefit of the ICP, where we can say, well, actually, we need to really put our thinking hats on because it's a consistent issue. But actually, what's local? What's care closer to home? And therefore, where is actually, if the ICP starts fiddling, it's unhelpful. So I think this is the initial thinking that I'm giving on behalf of the NHS at the moment, but it's not the NHS leading this, and I want to be really clear about that. Is there anything particular else that you'd like to hear, Councillor and Chair?
No, I think that's fine. I think I would say that obviously where I'm coming from is that in order to get that synergy between what the ICP is trying to achieve and what the health and wellbeing strategies and the health and wellbeing boards are trying to achieve, get the chairs of the health and wellbeing boards in the room, because then you've got the linkage. Or I think I don't know about everyone else. Obviously, in our case, the portfolio holder for health and wellbeing is the chair of the health and wellbeing board in my person. So therefore, you get that linkage into the executive role and the health and wellbeing board. I don't know about other authorities, but certainly that is where I would see that's where the conversation is, so that we're all singing from the same hymn sheet. And then when we take that message down into place, and in our case down into locality, we're making sure that we're where the ICP or where the ICS is delivering some element of our strategy. We know that's happening, and we're leaving it effectively, and our delivery plan recognises that, and we're not doing it, and there's no there might be overlap, but there's no double counting, and we're not trying to do the same thing in slightly different ways. So.
Could I take an action to work through what is what's the best way to do that from an ICBP perspective to get that right, to make sure we've got that it gives me enough time to always have meaningful conversations that mean we can have a conversation, and then how it's best done and the frequency and so on and so forth, and in what vehicle.
Let's you and I have a conversation offline about that, and I'll let Gordon set something up and we'll have a chat.
Thank you. If it's okay, I need to disappear to another meeting, and thank you very much for the time.
thank you for your time. And
Thank you.
okay, members, we move on to the next item, which is the West Berkshire vision and where we are and an update. And Kathleen's in the room. I saw him earlier. Where are you, Kathleen? Hello, Kathleen.
I'm here. Good morning.
To take us through this one, which is also a verbal item.
Thank you, Chairman. I will very briefly try to summarize where we are with refreshing the vision, and I will focus my presentation on the areas that we want to focus on the refresh, the delivery plan, and the approach to produce this refresh, and then progress to date around the work to refresh the vision. So whilst I have a few slides, and whilst they will make it onto the screen, just a quick reminder that for maybe members of the public that follow this meeting, the vision is not a strategy. It is an overall document that is owned not by one organization in West Berkshire, but by everyone in West Berkshire, the council, members of the Health and Wellbeing Board organizations, other organization functioning in West Berkshire, to set up our aspirations and hopes for the long-term period to 2036. If colleagues would like me to share the PowerPoint, I can do that, if that would be easier.
You crack on.
Okay, so let's see if I can do that right now. I will play the PowerPoint and I'll try to share it at the same time. Hopefully it's there now for everyone. So that's the vision. The vision has 5 hopes that we have for the future, and under each of these hopes we will statements or aspirations. What is it that we would like to do and achieve in West Berkshire? Now, the approach to refresh the vision, we looked at understanding a little bit to say what is happening with in West Berkshire, to understand if we want to completely rewrite the vision document, or if it is still a good enough document that withstands the challenges of what is happening around us, the COVID pandemic, the conflict in Ukraine, and so on and so on, and if it's still relevant the way it was written. The initial assessment against these significant changes in the context highlight that the vision is still very much relevant, and I will cover the elements of it in a moment. But the refresh, I will not focus much on this slide. Will be on, let's look at what progress we have made. Let's look if anything has significantly changed in the needs of people living, working, visiting West Berkshire. Very important, the engagement with residents, then to work to make some changes, to consult again with residents in a qualitative way, detailed way, and then the editorial and approval process. Now, the first step was let's decide what we want to do. Let's plan, and let's try to look at the progress that we made to date. Now, how can we look at the progress against something that is a vision, a long-term aspirational document? Framework as opposed to a strategy, and we discussed a little bit earlier in this agenda in this meeting about strategies, the Health and Wellbeing Board strategy, we have council strategy, we have organizational strategies. They supposed to support the achievement of these aspirations in the vision. The vision doesn't have a delivery plan, but we can nevertheless assess contributions that we make towards these we will statements and aspirations. Now, I focus on trying to mark each of these statement with achieved, work in progress. We need some further updates from some organizations and or other elements. And let's have a look at what we received back, trying to assess the progress. Very important, this is not the progress made by one organization, it is the progress that we together made since the approval of the vision in 2019 by the Health and Wellbeing Board. I would like to thank all the organizations that contributed already with their progress updates, and to Gordon here in the meeting that worked hard to bring the information together from all of you. So let's take each hope of the 5 hopes together, one by one, sorry, and let's look at the we will statements that we have listed in the vision document under each. You see on the screen, I use the work in progress or other column to say what is happening against each of these statements. I'm listing the statements there, but please, they are only a summary wording. The full wording is in the vision document. And then the last column there is initial suggestions from you, organization that provided the updates, if the particular statement and aspiration is still relevant, or if we need to do some work to look at them. So this first one around everybody having the chance to fulfill their potential here in West Berkshire, there is good progress made against all the statements, all the we will statements, and 2 of them around crime and around extremism. There is a suggestion that that's business as usual. There is nothing more than we currently do, and we should consider if we keep them or not, because work is happening anyway by the appropriate partnerships. Now, moving to the second hope in the vision document. In here, you will see that all the statements, all the we will statements, they are being progressed, and the suggestion is to still keep all of them. There is one there, number 18, marked as achieved, about rough sleeping, because by working together, I think we managed to reduce to 0 the number of people rough sleeping in West Berkshire as at the end of April, when we last looked at the information available. But nevertheless, we keep that on the we will statements, because it is so important, and because we need to maintain now that position. Moving to the third element, welcoming businesses and into a productive and growing local economy. In here, we have a couple of items where we need to look into more detail. Do we keep them or not? Do we need some more updates on them? The item 21, we're thinking is no longer relevant here, because it's covered in a sense by later on item 48 on the vision document, and because there are some dependencies with the planning inspectorate as well. Item 32, we were thinking to amend. There is a suggestion there, and we will look to see if we adopt that change. A similar, we want to add probably a commitment under item 36 to work together to ensure all active travel initiatives are joined up. Now, the fourth area, health and well-being of all residents, is good. Progress being made again, which is positive. On 42, a slight amendment, and 43, we need to look at the wording of that, but they are still relevant. 44, work is progressing through a number of strategies, but we need to capture better the progress that we are all doing around educating young people and supporting their families. And the last component of the strategy, the last hope, there about West Berkshire environment and the landscape and the cultural offering. In here, I think we did a bit more work in terms of capturing wider contribution. I have information from 1 or 2 organizations, but I think we will want to input more around items 49 to 51 with reducing CO2 emissions and other environment-related items. So that's most of them. We will keep them, and slight amendments to some, nothing super significant, which shows that most of the strategy is still relevant. Now, we are building then, in addition to the progress updates from you, we are looking again at the needs analysis, and we wanted to use the census 2021 data, but we are waiting for that to be published by ONS to see if anything has changed in terms of the West Berkshire population structure and other information from the census. It is very important that we will incorporate the feedback from the resident survey. We conducted a representative resident survey, so we can confidently say that the results will be representative for the entire population in West Berkshire, entire meaning 16 plus, and West Berkshire Council's executive will look at the results at their next meeting at the beginning of June. It is on the agenda. Then we will focus on the evidence base from the key areas that have been identified as the more likely to have changed due to the significant events in the world and locally. And then we will produce the final list of the aims for the vision. Needs analysis focus. What is it that we are looking at? We are quite well underway to look at this. The COVID impact, of course, the environmental agenda, the sustainability agenda, inequalities, including education, including the pressures and the cost of living pressures on population, understanding. We want to look at what has changed since 2019 when we first produced the vision document, and to bring all that information together. Very important is the views of the residents. In addition to having the representative resident survey results, we wanted very much to talk to the seldom heard people that will tend not to respond to surveys, to online consultations or paper consultations in the libraries and so on, our approaches to consult. We proactively went to invite people that normally will not be involved in consultation to hear their views about that. And on the screen now, there is a list of groups that we prioritized. We prioritized this based on our already knowledge of people that normally don't participate in consultations, but also based on the groups and subgroups of population. When I say groups, don't imagine organized groups, people that have set up as a group. I mean as people from particular areas, people from particular backgrounds, gender, ethnicity, and so on. These kind of groups, groups that are less the lower response rate to surveys as well. So young people, yes, they are listed in their rural communities, eastern part of the district to be heard, to be included. So the residents that will be focused very much about what will happen tomorrow and how they will manage tomorrow, as opposed to thinking to 2036, and businesses and voluntary sector. Initial feedback, this is not by any means final summary of what we are hearing from residents, but to give you a flavor, as we are processing the feedback from these individual qualitative meetings, they very much want to make sure that we have a section on well-being, and linked to that is about mental health, impact of cost of living, COVID impact on mental health, dealing with loss as a result of the crisis, to harness the COVID experience of connecting people, and linked to that is the loneliness, spiritual well-being was mentioned. Important for residents is the signposting to know what services there are and how can access them. Housing, addressing homelessness with on a stage-based solution approach. And the second slide on the same feedback from residents: equal opportunities to integrate the infrastructure, the bus, the rail, and everything else that is linked to transport. And then in the context of increasing cost of living, is no surprise that affordability of different aspects of life is highlighted by residents as needing to be prioritized and included. Moving on, what else we have on the to-do list to complete the refresh? We do the editorial work, then we work together on these we will statements to find, amend, maintain, keep. As you have seen a little bit earlier, the vast majority, the feedback is they are still relevant, they are still keep them there, it's still important. Then we will put all that in a format that can be shared and discussed with residents, and will conduct a final overall district-wide consultation with the public before taking everything through the approval process of different organizations, and then coming back to the board towards the end of this calendar year, December, for approval. Thank you. I will stop sharing now, and I will be happy to take any questions.
Members, we are under time pressure here. So I'm going to ask members if they have specific questions they might take up, particularly members of council. If they had questions they could take up with Kathleen direct. If you've got a specific on what he said, please do that. That would assist, because obviously we have a direct link into Kathleen, and obviously this is going to come back. Councillor Vickers, have you got I'd like to try to keep this short if we can.
Well, just a sort of quick comment here. I mean, I was interested in the update that it seemed to sort of add in a lot of the issues that were going through my head as the presentation was going on, particularly cost of living crisis, and how that, you know, and I know this is a strategic level, but, you know, I would like to hear at some stage, maybe through the Health and Wellbeing Board, what specific actions our council is taking, particularly with ensuring that people have access to information about the benefits that they are that they can claim, and particularly what the council can do. I think that's just such an extremely important element of what's going on at the moment, and good to see the sustainability issues in there, particularly as regards housing, and hoping that, you know, will influence good quality housing and insulation. And also the members of the community, although there's a lot of things that need to be done at a high level to help people with the cost of living, there are community initiatives, and quite often people aren't aware of these community initiatives which can help them. So a lot of the council has a role there in communication. So there's a lot of issues in there, but I'd like to see some possible action sort of earlier rather than later in some of them.
Well, I simply remind everyone that this is a vision document. This isn't a strategy, isn't a delivery plan. That I think those issues, Councillor Vickers, really need to be taken up Else, I'm not saying they're not important in the slightest, but I don't think I think the reason we're mentioning them in relation to the vision is because obviously we're looking in 2022 at a vision that was created in 2019. So we're not, and is supposed to be going to 2036. So we're not very far into it. I think we're looking at what has changed in order to develop any changes within the vision. But I'll leave it there. Let's move on. Thank you, Kathleen, for your presentation. Paul, we're now looking at safeguarding adults. We have a paper, first real paper to have a good read of. Paul, some initial comments, and then if we take some questions and move on, because this is an item to note, isn't it? We're not going to have to vote on it. Paul.
Indeed, thanks, Chair. Yeah, and just a quick reminder, a paper came to a previous meeting of this board from the Safeguarding Adults Board, which incorporates also Wokingham and Reading data. So this board wanted to say, right, what's the local picture? And that's what's prompted this report here today. You'll note, of course, it's Q3 data. That's just because of the kind of reporting process. We've now collected and reviewed the Q4 data. It's not introducing any significant new issues. Worth me saying as well briefly that there's plenty of governance and scrutiny of this. I want to reassure, not only are we members of this multi-agency tripartite, the three-borough board, but also quarterly reports of this kind go to our council's corporate board, looking at these performance metrics. So there's good scrutiny, and of course we also will have additional scrutiny in coming years when the CQC inspection process is introduced as well. So I'd like the board to have a warm feeling that there's a lot of attention on these metrics. I think the only other thing I'd add is that the key metrics, what have we made people safer? Have we acted quickly? Have we provided advocacy, critically for those people that need it? But also that we are applying the making safeguarding personal principles. And just for those that aren't familiar, it's about making sure that when we're acting to safeguard an adult, we are first of all hearing their view rather than doing to them. We're doing with them. We understand what they're trying to achieve, and we seek to achieve that for them. In very brief summary, it's busy, but I think well managed. It's, of course, the classic question is, does busyness indicate, does an increase in volume, should that indicate concern? Is it a bad thing? Are more people unsafe? Or is it a good thing because we are more aware of concerns, acting with more people to make them safer? So that is always the question that needs to be in our minds about volumes. But I'll stop there and take questions.
Councillor Doherty.
Probably more of a statement than a question, Paul, sorry. First of all, thank you for bringing this. I think I was the one that asked for the assurance that the information we had in the last report was actually what the situation was here in West Berkshire. And I think this report really lays it out very clearly for us. So thank you for that. I just wanted to, you went over there very quickly, the making safeguard personal. And actually, when I read through the report at 4.34, the way that we make safeguarding personal is really good. To see figures there that 119 out of 122, so 98% had achieved the outcomes that they were looking for. I think that is a really positive piece of work to show that we're really listening to our residents and we are working with them, or we're not doing it to or for them. So I just wanted to thank you for that, because I think it's easy to gloss over those. It's squeezed between two graphs there, but that's a really good achievement. So well done to the team, and thank you for giving me the assurance that I asked for last time.
And Sean.
Thanks, Chair. Thanks, Paul. I just wanted to pick up on one aspect of this, which is the issue of financial abuse, if I may. And as a service, in particular the Training Standards Service and the financial investigation team that we have within public protection, working with colleagues from TVP, continue to see a significant volume of fraud perpetrated on residents, and in particular vulnerable residents. Also, as a service, actually, as an observation, we do quite a lot to try and safeguard people from further fraud as well. And I'm just wondering about how we can capture that, because that actually is genuine safeguarding work that is actually going on, working with families, working with friends, neighbours, basically to try and prevent further defrauding of these people. I just really wanted to ask Paul, how much of this are you seeing, though, in terms of safeguarding issues coming through to you around people becoming victims of fraud?
Sean, thanks. Yeah, not included here, but we do routinely collect and compare data in terms of what is the type of abuse that we are trying to reduce or remove, and where's it coming from. I think it's concerning, of course, that a lot of the abuse is undertaken by people who should be trusted, whether it's family members or carers. So yeah, we watch it closely. I'll certainly note the precious of time. I'll ask Sue Brain to make a direct link in with you, Sean, make sure we're doing everything we can.
Yeah, thank you.
And Councillor Masters.
Thank you, Chairman. Thank you, Paul, for the report and your summary. I won't go through it to forensic level. Just looking at the timelines and for completion, and on 4.2 of the report, and it talks about the figure being between 50 and 60% for the complete conclusion within 30 days. It's clear that that's the figure for this year. How does that look? First off, how does that look historically? Is that the standard 50 to 60% over the last 5 or however long you've been recording it recently? Does that stand up to that? And also in terms of ones that aren't concluded, what percentage are more than 90 days and such like, and is that down to complexity or lack of resource, lack of engagement with partners and the service users, etc.? Can you just broaden out that?
Thanks. Absolutely. Yeah. No, I think complexity is probably the single key answer to this. I speak with Sue Brain, who runs that team regularly. It's concluded is quite a high bar. We've done everything we can, and now we're going to stop. There is a lot of work, which does. So I would want to reassure that work is going on. This is not that we wait until day 29 and then start work. This is about saying we've made a beginning, and there are complex questions in terms of how to make this person safe as they want and as we are comfortable with. So I can dig and circulate some more data on the longer term. But yeah, to reassure, it's about making sure that all actions that we think are appropriate have been taken and seen through to their final conclusion. That's what takes the time.
And those figures of 50 to 60 over the last 3 quarters, as recorded in the, does that pan out over the last 5 years, say?
I think I'm testing my memory a bit, but I think we're actually concluding more cases more quickly than in previous years. I think this is an area of improving performance, but I'll double check that.
Okay, that'd be great if we could share that. Thank you, Paul. Thank you, Chairman.
Thank you both. Paul, I'll leave you to take that up with Councillor Masters offline. I don't think need to come back. Thank you both. Right, let's move on to the paper on the Hampshire Pharmaceutical Needs Assessment. Just to introduce this, you'll remember, members, that this has already been circulated so that you can individually respond to, should you have wished to. Consultation ends on the 5th of June, and you'll see from the paper that a joint response isn't considered necessary because NHS England will be responding, and they've got a better knowledge, we think, of cross-boundary issues. But you have a paper. Zakia, I'm hoping you're not going to need to speak to this particularly. Do so if you wish, and I will take questions otherwise.
I'm happy to assume that board members have read the paper, and it will save my voice. I apologise, my voice is a little bit weak today. Happy to take questions.
So, Councillor Bank.
Thank you, Chairman. As you know, Chairman, our wards straddle counties and are very close to county borders. I just wondered how the extent of the consultation, what is the extent of the consultation? Because I can imagine hearing from Aldermaston Parish Council saying that they use surgeries across the border in Hampshire. So the local people are keenly aware of and concerned about access to cross-border provision of NHS services. What's the extent of the consultation?
I'm happy to respond to that, or would you like to hear all the questions first? So in response to that,
that's the only hand up, so I'm going to take it. That's the only question.
Okay, that's fine. Thank you. I think it's a really important point, and it's one of the reasons why Hampshire are undertaking a consultation and are sharing with the health and wellbeing boards across its own boundaries, as we will when we do our own pharmaceutical needs assessments. To give the context, the board has, health and wellbeing boards have a statutory duty to receive and engage with pharmaceutical needs assessments for the very reasons you say, to ensure that individual populations and areas have access to the primary care services that are provided at community pharmacies, to provide essential services such as prescription issues, repeat prescriptions, and a whole series of other services as well. So this is an opportunity to ensure that our local areas, which do cross across the boundary, we are to the north of Hampshire's boundary, and those areas do feel that they have had the opportunity to have the services recognised and that they are available. Therefore, if individual members feel that there are specific issues, then I think the suggestion, the proposal is that councillors can actually raise these directly, recognising that there is an important role for NHS England improvement to ensure services are available, accessible, and contain the necessary requirements to make sure that our populations are served with a good pharmaceutical services in the areas.
Thank you both. And do you want to come back on that, Councillor Wade?
I guess my point is, are you consulting close enough to the users of the service? I mean, if it's kind of going to this level, that's fine, because I can pass on the consultation to parishes that I know will be interested. But are you doing that already?
This is quite a formalised process, recognising that we haven't necessarily received them in the recent years because of COVID. NHS England deferred it to July of this year. As part of the consultation process, each pharmaceutical needs assessment looks at the population needs, what services already exist and how far away they are from key areas of population, and whether practices locally are also dispensing practices. And all of that information is captured into the needs assessment as is. There is a link to the needs assessment in the paper provided today, and those elements are captured in. But this is the opportunity. If there are specific concerns that you feel haven't been captured, then this is the opportunity to actually respond and raise those.
Thank you.
I'm going to leave you to take that away and consider it, Councillor Beck. Indeed. Members, this is a formal item. We do need to vote on it. I am going to ask for an indicative vote. So will everyone, whether they're in the room or out of the room, please indicate by raising your Zoom hand. You should have a little key at the bottom of your screen, whether you agree with the proposal at 2. I am seeing a sea of hands. I'm guessing Andrew, as usual, is abstaining. Yes.
Yes, Mr. Chair.
Indeed. So, members, you can see that there is effectively a sea of positives. I now ask members in the room to vote by raising their physical hand. I will propose from the chair. Councillor Doherty will second. Proposal as in item 2. Carried. Thank you, members. We move on. Thank you all. We move on to item 12 on your agenda, which is Belinda talking to us about we've been talking about it earlier, but let's hear what's going on with the place-based partnership, the PBP, as we're all going to have to get used to. You'll know what I've said about time, Belinda. Sorry, to put you under a little bit of pressure there. Over to you.
No, thank you very much. So these are the Berkshire West Unified Executive priorities for 2022-23. So just as a little bit of background, Berkshire West has very robust partnership arrangements in place. Obviously, the Unified Executive works alongside the relevant health and wellbeing boards to deliver the strategic priorities. So this sets out what those priorities will look like, and these are the priorities which have a particular focus for 2022-23. So the other thing that I wanted to really draw out is the connectivity across the different strategies as well, which hopefully I'll do on the next slide. If you could, please, Gordon. Yeah, so what we have the very clear Berkshire West Health and Wellbeing strategic priorities. We have the previous flagship priorities, and what I just wanted to do is just not map, but actually just give a kind of sense of the context. And actually, all of the Unified Executive priorities I can quite clearly map back to the Health and Wellbeing Strategy priorities, as well as the BOB priorities as well. So I just wanted to kind of give that as a context. So moving on, if we could. Okay. So this is a new programme, cardiovascular disease. You will see that there is an executive sponsor. The Unified Executive members are each have been asked to actually sponsor one of the programmes. So we're very lucky that Dr. Dashowitz has agreed to lead this one. This builds on the success of previous work around building an integrated musculoskeletal pathway, but this is with a focus around cardiovascular disease. And I think that the key bits around this are around earlier detection. Many people are diagnosed in the acute setting with heart failure. And actually, we need to get better at doing things, at picking up these cases much earlier. If we can diagnose earlier, we can get people onto the treatment programs as well. And we do need to be thinking about how we use digital as an enabler to support people in terms of any escalation or exacerbation of their condition. So these programs started in April, and actually I'm due to have an update this week on where on progress. So that's that one. If you could move on to the next one, please. So MDT working. So across Berkshire West, there are robust MDT teams in place. This one very much took account of what was coming out of COVID. There was quite a significant rise around mental health. Now, this one is quite a scoping programme where really it's about how do we pick up and identify those people who have low-level mental health needs, perhaps not known, and in fact unlikely to be known to statutory services for their mental health conditions. So again, very much using the MDT approach and also digital to help us to understand our population profile as well, so that we can focus on this particular area. So the next one, please, Gordon. So children and young people, this is a very well-established programme. It's, I think it's beginning to come into its second year. Quite significant transformation. It's reported up through the Children's Board, as well as being monitored through the Unified Executive as well. And I think it's really important that we do whatever we need to do to support our children, who are our future, to help to reduce stigma, to identify mental health problems, so that we can give our children the best outcomes. And so a very far-reaching programme of activities actually planned and underway with this one. If we can move on. Yeah, so this one again, it's a continuation. The reason that this one is one of the Unified Executive priorities is because of the value of the funding that's available, £6.3 million over I think it's the next 4 years. And it really is an opportunity to actually to build the resilience within our primary care, and to actually support the development of the PCNs as well. Now, we do recognise that actually the workforce is a real issue. It's an absolute enabler, but it is an issue. And so one of the kind of the key metrics within this particular programme is to actually look at joint or rotational posts as well. So we're not kind of taking from each other. It is about trying to work with our kind of educational providers and work with our partners to actually increase the number of staff within primary care. And you can see within this that actually we're trying to look at more diverse recruitment, so first contact physiotherapists, social prescribers, and physician associates as well. So building a real multidisciplinary teams within those PCNs. So if you could move on to the next one, Gordon. So the rapid community discharge has been deemed a priority by the Unified Executive. So the programme was funded through the National Hospital Discharge Programme. That funding ended in March of this year. And the programme over a couple of years was around £12 million. So some additional money was made available during April and May as part of the traditional arrangements. And so we continue to support the principle of the Rapid Community Discharge Programme, but there is some learning to be done. And I suppose the next steps is that the services will revert to pre-pandemic operating model, and that our local leaders from across the NHS and local authority are going to be meeting in the near future to actually discuss what an optimal hospital discharge model looks like and how is it funded. So that's the presentation from me. Happy to take any questions.
And Councillor Doherty got in very quickly.
I'm actually, I mean, Belinda, thank you for the presentation. It's really useful. I'm actually it might be a question for our chair, actually. There's a lot of information that you've just given me for the first time. It's a verbal presentation. I don't know what I'm supposed to add to this at this point because I haven't had the opportunity to actually read in detail. I hear what you've just said to me, Belinda, but for me to be able to scrutinise or for me to be able to understand, I need the opportunity to digest, think what it is I would like to find out more about and come back to you. So I'm kind of just sort of saying, is it right that we get this as a verbal item today and how are we supposed to respond?
Hear that. I think that, I mean, it's difficult with these things, whether we distribute papers, I mean, the traditional type of paper which comes from officers, or maybe distributing, if it's going to be a PowerPoint, for example, PowerPoint slides beforehand. I think Gordon and I take that criticism, and I think it could be perfectly valid criticism on board. Perhaps what we should do, Belinda, is obviously make sure that we're going to distribute all the slides anyway after the meeting to make sure everyone's got a chance to assimilate what's there. If you take individual questions direct to the PVP, and then if there's any member who feels that there's more that needs to be said, we bring it back as another item, because this is going to be a continuing debate. I mean, this one isn't going away. So it's all part of that whole ICS, ICP, place-based partnership, all the whole system, region, place, and indeed locality approach to health and well-being that, to some extent, what we're here for. So if we do that, if rather than, unless anyone has a specific question, they went, oh, that's just flagged something in my head from what you've just said, we'll take these effectively offline and then bring it back as a developing piece. Is that, that's fine, thank you. So members, Andrew, please.
I think one of the quick questions I've got in terms of both assurance and things like this across the sort of system solutions is that, without necessarily putting Belinda on the spot about the CQC report about Hunter Coombe, if there's pressures in the system that come out of programs like this, it seems odd that the Health and Wellbeing Board isn't sort of being sort of warned or said, look, we have a problem with X or Y. We're sort of, you know, we're sort of reading about it in the paper. and I just with children and young people, such an important thing. I think for that to come out just with sort of no reference just surprises me, and it just sort of worries me that as this bigger system develops, if we end up with pressure, not necessarily in children and young people, but elsewhere, how does the Health and Wellbeing Board deal with changes and pressures in the system? Because the whole system's under pressure. We've discussed dentistry and various other things over the course of time, but it sort of feels like we're watching it rather than actively being engaged. So it's both a specific and a general question, if that helps.
Let Belinda come back.
Yeah, so I'll pick up the more general point, and I think that's a very fair challenge about how agile can we be, and I'm thinking in particular around the unified executive to changing needs and actually monitoring those things as well. So I think that's a discussion that I will have with the chair of the unified executive. So thank you for that.
Can I suggest we have that as an action, so that there's a report back, so that we know? Andrew, okay with you? Fine, good. Okay, members, that was an item for discussion. It wasn't an item we need to vote on, so we shall move forward to an item we will need to vote on, and this is the defibrillators motion and the paper in relation to response. Now, we've already discussed this briefly once. We looked at the motion and decided what we would do in terms of research. The paper reflects what was done as a result of reviewing the motion at a previous meeting. And we have a commentary on what officers have effectively discovered by particularly talking to parish councils and town councils, but particularly parish councils, about what defibs are out there in the community, whether they are registered on one of the apps in order that someone, if they didn't know where one was, could find it. Although I had a discussion about this at a first aid course I recently attended, and the conversation went along the lines of, are you really going to think about going to an app if someone's lying on the ground in stress and difficulty, and you think, I need a defib? Really, you need to know where it is. And hopefully there will be people with local knowledge who will say, there's one in that phone box, or there's one on the wall of the pub, in our case. So I'm looking and I can't see. I'm just going to check with Gordon. Councillor Abbs is not in the room, but I know he was. I made sure that he was invited to the meeting, but he's not in the room. So members, you have the paper in front of you. I'm going to invite Zakia and Gordon between them to present the item and tell you what are the recommendations and what we are voting on. And then I'll invite anyone to ask questions. Whichever of you want to kick off, Zakia.
Thank you, Chair. I'm happy to do that. As you will have sort of seen from the paper, this was, and as Councillor Richmond has mentioned, this has already been discussed. I think it's really important that we recognise that a lot of information has gone into preparing this paper, particularly around how useful it is to have both the telephone boxes and an AED at the local area. And I think it's really important to recognise that the decision isn't just about using the telephone boxes and to have the AED device. It's also about the maintenance, the accessibility, the replacement as the time runs out. So there is a whole process involved in managing and maintaining the presence of an AED. I think for me, the most important element of this is how useful it is in terms of the outcomes. And I think it's already been alluded into the paper, but I will reinforce that particularly in sparsely populated areas, the most important thing is actually to do basic life support and to call the paramedics. Those are the important things that have an impact on outcome. However, it is a really important area, and I think there's a lot of interest in this area. And as you can see from the proposals, this is about what can we do that actually encourages local knowledge and local skills. And one of the things that I think, well, two things that we're proposing is that we really focus on increasing basic life support through first aid courses, through basic life support community-based courses, and for more people to be very comfortable and familiar with that process. And secondly, just to ensure that we do encourage, whilst I appreciate that the app may not be the first thing you go to, at least being aware that there is an app available and familiarising ourselves with the availability of the app. I think finally what I would say, and before I take questions, is that we really need to look at how the funding is being used, and if funding is to be proposed for this, then just to be very clear what is the continued sustainability of that funding as we go forwards. So I'm going to stop there, and I'll have to receive questions and comments.
Indeed, I'll just check Gordon hasn't got anything to add. He shakes his head. Councillor Vickers.
Yes, thank you, Chair, and thank you for the summary of the paper. I mean, this is it's important practical action. It's a shame Councillor Abbs can't be with us. I know he's not been at all well, so possibly his absence might be related to that, but this is something he cares passionately about. I noticed in the paper that the evidence of the effectiveness of the defibrillators is not conclusive, but even if they serve a few lives, that's lives that have been saved, and I'm sure they have saved and will go on to save lives. Obviously, the issue is the partnership between the parishes, the town and the district about how we fund and manage these, and I think there is support across the different councils for them. So hopefully that can be organised. And I agree, but the most important thing here is education and life support. And that is the one I think that's sort of put down under the umbrella of the district council, but with question mark over funding. So I hope that that can be progressed and that the funding won't get in the way of actually making sure that all of us know how to save lives. And that's programs in schools, programs in the community. So I think I'd like to see that is that actually is something we can sort of commit to taking some action on, sort out where the funding can be, make sure that that's a priority. Because I know using these defibrillators is meant to be extremely simple, but nothing is simple until you've been told about it. So first aid, including the use of the defibrillators, local people knowing where they are is just so important. So I think that's a crucial thing. I think that's the most important thing, is the training and the knowledge and the partnership, obviously. So yeah, I support all the recommendations. Thank you.
And Sean.
Just very quickly, Chair, obviously, I mean, the points about knowing how to use defibrillators and awareness basically are very well made. I was just going to make the observation that we have a number of events lined up over the year to do with water safety as a result of the work of the Water Safety Partnership. And I will go away and have a look at to what extent we can extend those to pick up some of the issues around the use of defibrillators as well, as we're out and about in the community.
Thanks, Sean. And Gary.
Yeah, just finally, yeah, completely support it. I think the existence of the defib machines in those phone boxes will also ensure the maintenance of the asset of the phone box itself, which could be used for other things, and indeed is, as libraries and so on, so book exchanges. I think it's a good thing.
Yeah, and I'll just conclude by saying, yeah, defibs in phone boxes, if the phone box isn't needed for either as a phone box or already being snaffled as a library or something like that, very good idea. And it's not critical that they're in a phone box because, as I say, we've got one on the wall of a pub, one on the wall of a village hall, and so on and so forth. And the one that was in the phone box, which we got through a member's bid, was vandalised the other day. Never mind. Such is life. Andrew, before I completely conclude, Andrew.
Yeah, just a quick sort of thought on this, that it always surprises me how low level the sort of first aid and life-saving knowledge and courses are sort of seen. You know, it's sort of, you know, there has to be a first aider as a nuisance rather. And, you know, and there's so many studies about European countries where it's part of the curriculum and various other things like this. and it makes a material difference. It would be brilliant to see the actual statistics of the success of this in comparative European countries, because it's really quite stark, I believe. So I wonder whether a really practical thing the Health and Wellbeing Board could do is come up with some sort of program to sort of really encourage or fund or encourage employers to run regular courses like this and make them really accessible. So, you know, I think if you look at the success of how important employers treat safeguarding and things like that as a statutory piece of training, almost no person is allowed to start work without doing safeguarding training, and yet first aid and life-saving knowledge doesn't seem to be even on a par with that. So, you know, is that something locally we can do without sort of having to wait on national directives?
Yeah, I'm in complete agreement with you, Andrew, on that. Indeed, as I said, I think earlier, I recently attended what was for the rest of the group an all-day first aid course. I could only stay for the first hour or so. That was run by Wellbeing Walks, and it was absolutely superb. And if we can get that out into the community, get that kind of thing. And I also think I know a lot of this is practical hands-on, but just seeing what you need to do, do it practical hands-on if you can, excellent. But if we can, it would take all those things on board. E of the recommendation is in relation to something along those lines. I would take that away and reconsider it and see what we can do about getting it out into the schools, and Councillor Boak's no doubt listening, and generally and into the community, but certainly working with some of the providers in order to make this available and emphasise to the public how useful it is to have some knowledge of first aid. I think we can't go far wrong. So members, this is something we're voting on. We are voting on the recommendations at 2.1 of your paper, A to F. Look for indicative vote. Those in favour, please show a Zoom hand. Thank you, Councillor Vickers. Yeah, excellent. Thank you. And yeah, well done. Okay, put your hands down. Those against? Not yet. No one against. Excellent. Right, so I will propose from the chair. I think Councillor Doherty got there before me, trying to second. So Councillor Doherty, second? Yes. All those in the room in favour? And that is unanimous. Thank you. Right, excellent. Thank you, members. Okay, we move yet further on. We now come to items for information. So members, at item 14, you will note the leisure strategy at item, so hopefully you'll note that. If you've got anything you want to comment on the leisure strategy, you can't because it's too late. It's been adopted. Noted, and if you have anything you want to raise, please take it up with Howard Wilston, who has the happiness of having that portfolio. Next, we have members' questions. Gordon, I don't think we've got any.
No, we haven't received any questions.
And item 16, members, is the forward plan. Does anyone want to raise anything in relation to the forward plan? It's for information, and obviously it is being adjusted as we speak by the conversation we earlier had about place-based partnerships. And finally, you have future meeting dates. I think they're in the pack, aren't they, Gordon? I don't need to read them out. So members, please note, and unless anyone has, obviously there isn't any other business item for these meetings, but if anyone has anything else they want to raise, anything they want to bring our attention to, fine. I thank you for your time. Please stay in the virtual room until the meeting has been closed. I call the meeting to a closure.